So, Sam, thank you so much for joining us today.
Pleasure.
Good to have you back again. Second time recording this one.
You bet, man. It's the technology gods. What can you do?
Yeah. So can you kick us off and tell us a bit about your background and what you do today?
Yes. So my professional career started as a web designer. That's what I studied at university. But kind of straight after like a year of working as a web designer, I decided that I didn't want to sit at a desk for the rest of my life. And so I basically decided that I'm going to up sticks and train to become a snowboard instructor, which I did out in New Zealand. And then for the preceding 4 years, I was snowboarding from New Zealand to the Alps, to then back to New Zealand, then to the Rockies, and back and forth here, there, and everywhere. And then in 2010, I was again getting sick and tired of kind of having to make new friends every 6 months. So you can see that I'm trying to like find my way in the world at this point. But basically, I stumble upon wanting to become a personal trainer because in my final season in Canada, in Banff specifically, I basically gave up alcohol. So since January 2010, I've been, 100% teetotal,
Good man.
basically. Thanks. And yeah, and during that time as well, I kind of had these dreams of getting on the front cover of Men's Health as well. So I got in really good shape. I was nowhere near the bulk needed.
Mm. More,
To be
more
on Men's
steroids
Health
needed.
cover. Yeah, exactly. But I got down to 5% body fat, and I was really pleased with the
Yeah.
results. But anyway, as a result, I wanted to get into personal training. So I studied at the European Institute of Fitness, and became a master personal trainer from there, and then moved to London. Moved in the box room of my brother's house in East London. Managed to get a 50 quid a week deal, which is pretty good for East London these days. But anyway, so I set up my personal training business and then got into fitness boot camps as well. And then over the next kind of 4 or 5 years, I built it to be kind of 10 locations around the country. And at that point, I was getting kind of frustrated with the number of clients that kept on kind of having to come back to us after having gone out into the world and kind of saying that, what you're advising me nutritionally, my friends say isn't good for me. And I just kept on thinking that we're always just going to be battling uphill in terms of government guidelines and things like that. So I decided that the only way that we're going to sort this out is by setting up a charity that would fully focus on improving nutritional guidelines, particularly in the UK. And so I pitched this idea to a lot of the players at the time, and still are, who are now on our scientific advisory committee for the PHC. Pitched them this idea of a charity. They said, lovely, but where's the money going to come from, as always? And so I went about setting up an online crowdfunding campaign. We doubled our target within the month, and we've been going from strength to strength ever since, basically, for the past 7 years. So it's been a wild ride.
That's amazing. And you mentioned that when you were doing the boot camps, you had clients that were rebounding back into you and saying that their friends were saying that what you were advising nutritionally, they were saying were bad for them. Like, what were you advising?
Yeah. So my general approach is for people to kind of start off with low carb real food, basically. And so I was telling them that you feel free to re-include butter or even lard if you want to, but like just as you're cooking, shortening, not like piling it on in your coffee, just as you're cooking, thing. Just saying that you can have red meat as many times as you want during the week. It's really not an issue. And so I'd find that they'd be good on the exercise because they were coming to the sessions. and that's great. And you know, they go through stages of being really dialed in on the nutrition, but then they'd kind of like veer off basically, and part of that is kind of the discouragement that you get from friends, family, and even unfortunately healthcare professionals, because they're saying, "Oh, you should be having 50% of your diet from carbohydrates, and you should have healthy whole grains. You should be eating low fat foods as well, and all of this." So yeah, that was what was really kind of spurring me on to try and sort this out.
It's difficult, isn't it? Because you have like the people in authority and who are meant to be an authority on all things health, like the general practitioner. They're not actually skilled up. They have incredible intentions, and like I've no doubt their heart is in the right place, but they're not skilled up to advise on nutrition.
Yeah, it's really quite worrying actually, because when you speak to some people in those positions, either their knowledge is based off of quite old science, kind of like 80s and 90s observational studies and things like this. I once ended up in a disagreement with a doctor who's like a neighbor of my wife's parents. My wife is French, so we're over in France, so like we got in this discussion, and he was like, "Yeah, but we were taught this," and like he showed me the study. He was able to pull up this study, and it was from like 1995, and it was like a 3,000 person observational study. I'm like, that doesn't mean anything. I've got like 70 RCTs that go up to 2023, well, 2020 at the time. If you want to see them.
What did he say? Did he accept the new research and change his mind, or was he hanging his hat on this?
Instantly. Yeah, no, I think that was a case of planting the seed. Yeah. And that's kind of what you have to do from this position is try to plant as many seeds as you can. Just don't try and ruin the soil too much, because otherwise they won't take to grow.
Yeah, you don't want to shatter someone's world, because then they'll probably get defensive, or they just won't take it on board. But it's difficult because a doctor is used to being the one who has the answers, and like the worst thing is when a patient comes and says they've Googled something, and obviously loads of people do that for loads of different conditions. So why wouldn't they just dump the nutrition stuff into the same basket and say like, because there's, you have so many people who come in and say, "Doctor, I've definitely got cancer." And it's probably just like a tight muscle in their neck. And so like they have to just, they're constantly like fighting this tide of Google advising people. So it's no wonder they lump it into the same category.
Yeah, certainly. And that's kind of part of the work that we're trying to do at the PHC, is to try and kind of bridge that gap, and kind of present this message that there's solid science behind all of this. The randomized controlled trials are quite supportive of what we're doing. Also, the real world studies, like Dr. David Unwin's work, for instance, up in Southport, that's been published in BMJ Nutrition at least twice now, and like a few times before that in other journals as well. So we're basically trying to build an evidence base.
Dr. Unwin's work, because I've heard his name bubbling up a lot more, and he's very much involved with the public health collaboration. So tell us a little bit about the success that he's having.
Yeah, so Dr. Unwin's work has been going on almost 10 years. And it was a case of one of his patients coming in and being literally half the woman that she was, essentially. And he was like, "Okay, wow, how on earth have you done this?" And then she went on to say that she did it through low carb, basically, and that she put her type 2 diabetes into remission as well at the same time. And so he started investigating all of this, and found it to be rather compelling. And so for the past 10 years, he's been advising that in his NHS GP practice up in Southport in Lancashire. And over the past almost 10 years, he's been building up his data set, and he's reached about 100, just over 120 people going into remission. Wow. From type 2 diabetes. but if you look at his data set overall, he actually ends up through the patients that he diagnoses, 50% of them go into remission. So it's a 50% remission rate on patients that he's working with. So just imagine if we had that rolled out across the entire country, where 50% of those with type 2 diabetes would be able to put it into remission, basically. And then on top of that as well, so for pre-diabetes, the remission rate is even better. It's 90%. So like if you catch it earlier for the pre-diabetic level, then you're almost guaranteed to, well, not almost guaranteed, 90%.
So are you likely to, with the public health collaboration, are you pushing to have, what are the main goals and aims? There's a complete overhaul of the Eat Well guide.
Yeah, so that's one of our lofty aims, would be to get new healthy eating guidelines in place, and ones that are flexible as well, because at the moment there are just one set of guidelines, basically, whether you're healthy or not healthy. And so, what we want are flexible dietary guidelines, ones that are kind of more appropriate for those with type 2 diabetes and obesity, for instance, and ones that are for people that are maintaining personal good health. But even within that, you should, as long as you're able to maintain personal good health, you should be able to have that flexibility of, if you want to follow a vegetarian, higher carb, real food diet, if that enables you to actually maintain personal good health, then go for it. But equally, somebody should be able to follow a low carb real food diet that includes butter and lard and steak and things like that, and not be made to feel bad about it, because the evidence doesn't support that, basically. So that's one of the lofty aims. And the other one is to get type 2 diabetes remission guidelines into the medical guidelines in the UK as well.
I mean, I love it. I love the aims, because I think like it's something that, if you just look at a chart of diabetes and diabetes diagnoses over time, it's just going through the roof. But some people, some companies are making a lot of money from that. So, and there's so much evidence out there of skullduggery and people just messing with, getting the right people in the right places to get the right dietary guidelines to, and Seventh-day Adventist stuff, and like all of these different competing interests. So what's your, like, you've obviously made ground, but where do you think this is going?
Yes, how can we actually kind of make that progress? Revolution always comes from the bottom up, basically. And so the only way that we can do it is by galvanizing members of the public, but also healthcare professionals at the same time. And that's essentially what we're on the path of, really. So we have a large number of passionate members of the public who have put their type 2 diabetes into remission, and all sorts of other things, that are volunteers for us, that help set up free lifestyle support groups in NHS GP practices. And what happens there is that when those get set up, then that kind of inspires the healthcare professionals in those GP practices, and they see the benefits to their patients, and then they become advocates, and then we start to get a quote unquote army of healthcare professional advocates. And when we get to a critical mass of that, then that's when we can try and force the hand of the powers that be.
I like it. I like that idea, because it's almost like you got to keep talking loud enough until they can't be ignored. And you probably know a bit about the financial structure of how GP practices get funding. So if these GP practices save money, so like Dr. Unwin saving, did you say it was 50,000 a year, or
68,000
pounds a year just for his practice that he's saving for the NHS? And so obviously if you scale that out to all of the practices, but do those GP practices, do they get a bonus from saving money, or does it just they just get the budget removed, or like
Yeah.
do they
So
make
like
less money? Does the
it's
doctor make less money because his practice is,
even.
you
Yeah,
know?
right. So yeah, Dr. Owen doesn't see a penny of that at all going back into the workings of his GP practice. So there's no currently there's no financial incentive for GPs to actually go about doing this. The only kind of slight indirect financial incentive is this thing called QOF targets. That's QOF. So that's quality outcome framework, and that kind of like those outcomes that you've got targets for go across the board in all sorts of things, you know, in terms of what was it, screenings for like breast cancer and stuff like that. But one of them is actually referring people into structured education, right? And there's this other GP, another David, Dr. David Oliver in Essex, along with his colleague Dr. Kim Andrews, who have this practice called Freshwell, and they've got this really great free app that people can download. But they've got this video course that GPs can now refer people into, and it's totally free, but they can then tick off a QOF target, and that all goes into kind of like the GP practice appraisals, and that can kind of set budgets and things like that, but it's really kind of indirect. So currently there is no direct financial incentive for GPs to actually deprescribe, and that's something else that we want to try and work towards, is the fact that, you know, if GPs are actually improving patient health and reducing the amount that they're having to spend on drugs, then surely they should be getting kind of like some sort of financial incentive.
Yeah, because that's what I've heard many times, that doctors are not gauged on how well they can get people off medication. They're often incentivized, especially in the US. I don't think it's the same in the UK, but US incentivized to get people onto medication and keep them on for as long as possible. But that's not the same in the UK because there's no kickbacks in the UK.
Not exactly. I mean, you know, again, it kind of goes back to this QOF thing, and kind of, you know, if you're not meeting QOF targets, then you can kind of get slaps on the wrist and stuff like that. So, and that can, you know, be, you know, how many statins are you prescribing and stuff like that. So, like, whatever's happened is worked out in terms of working around the NHS system rather than the American system.
Yeah, do you see? I see a lot of people crowing, saying that the NHS is too big and it's too cumbersome and it's too bureaucratic. What are your views on that?
It is a big beast, that's for sure, and it is over bureaucratic, definitely, but it's certainly worth saving, and it can be saved. And I like to think of it, rather than kind of like being a victim, it's just like it's a big machine that has just had too many bolt-ons and too many spanners in the works, and it just needs to be fixed. And that's kind of one of the things that we're trying to really try and promote this year, is that, you know, if we focus on lifestyle interventions that can proactively improve chronic diseases and even prevent chronic diseases from even happening in the first place, then the NHS can be completely fixed. If we focused on kind of that model, then we could, you know, save up to 35 billion pounds per year from just the, you know, the 6 big chronic diseases: type 2 diabetes, cardiovascular disease, obesity, cancer, dementia, stroke, and Alzheimer's as well. So just those 6 alone, we could save 35 billion quid a year, and all of kind of like, you know, the appointments and the resources that those take as well.
That's the funny thing, is that all those 6 that you've listed, that's basically metabolic disease.
Yeah, exactly. So all of those are massively impacted by metabolic health and are largely preventable as well. So that's why, if you focus on those, that's a workable solution that you can actually go about trying to alleviate resources, both human and monetary and financial, for the NHS, which would in turn kind of, you know, fix it in a way, like organically almost. Yeah. You know, the bureaucracy would kind of go away because you wouldn't have these increasing problems.
Yeah.
And when problems start to get smaller, then, you know, well, that sort of thing starts to go away.
When problems start to get smaller and then people start to see that their job might be on the line, maybe those problems are going to start getting bigger in the end. That's the problem. People are incentivized to justify their job role.
Yeah, right. Yeah, totally. And that's a big part of it. You know, it's like the end of the financial year budget, and you know, you find out that you've got a 20 grand spare, and unless you spend that 20 grand right now, then you're not going to see that in the next budget. So like, people just spend it on, like, I don't know, let's buy a new photocopier, and I don't know what else.
It's
just
crazy.
Everybody gets a new office chair. That sort of thing.
Yeah, it's madness. But I want to talk about your self experiments, because I love these. Like you almost took the initiative into your own hand and went, right, I'm going to have a look and I'm going to prove that different food affects you differently, and it's not all calories are not equal. So can you tell us about your self experiments that you actually got published now, right?
Yes. So this is now in the peer reviewed literature, incredibly, with the incredible help of Dr. Eric Westman, who's just a pioneer in this space, really. He did one of the first low carb RCTs back in the early 2000s. And he kind of like learned directly from Dr. Atkins and things like this. It's an incredible story. But anyway, so my self experiments, I actually conducted them in 2013. And so that was kind of right in the middle of me running my personal training and fitness bootcamp business. And I was trying to figure out a way that I could demonstrate to my clients that not all calories are created equal. And when I say that, I don't mean as they sit on your plate. I mean as they're processed through the human body. And so being a slim individual, I thought the only way that I can actually do that is by doing a weight gain experiment. And so I basically overate twice as much as I usually would, and I did it on 3 different diets for 3 weeks each, but with 3 months break in between each one, so I can kind of biochemically reset. Now, the first one was low carb real food, so it was like, you know, salmon and eggs for breakfast, with some green beans, and then, you know, nuts for a snack, and then it was like mackerel for mackerel and green beans for lunch, and again like a load of nuts, and then steak and green beans for dinner, and then some nuts in the evening, and that took me to just shy of 6,000 calories every single day, and over those 3 weeks. And I calculated, you know, the dietary, the loss of dietary fiber, the exercise that I was doing, the protein thermogenic effect, all chucking it into the Harris-Benedict equation and all of this jazz. And over those 3 weeks, I ended up in a 47,000 calorie net surplus, basically, which means, according to the calorie formula, I should have put on 6.1 kilograms. I actually only put on 1.3 kilograms, and I actually lost 3 centimeters on my waist as well during that time. So that's a really interesting observation by itself. But as I say, I did 2 more experiments to kind of see exactly what was going on. So this second one, I did low fat fake food. And because it's low fat fake food, it's got a lot of packaging on it, so I was able to get, you know, exact calorie counts on it, and I managed to get myself, again, after the loss of calories from dietary fiber, protein thermogenic effect, exercise, I managed to get myself again in a 47,000 calorie surplus, and so should have been 6.1 kilograms of weight gain, but I actually put on 7 0.1 kilograms. So I actually went over the calorie formula on this one, and I put on 9.25 centimeters on my waist.
Wow.
And for a guy that's always been naturally slim, putting on a few inches on your belly, that was quite a shock. You can tell me.
That's ridiculous.
It was, man. It was crazy. I had a proper baby growing.
You had the chin. You had the chin as well. I can see from the photos
as well. Exactly. If you look on the photos, I get a proper like that's my usual profile. But
yeah.
I was like this.
Yeah. Remarkable.
So crazy, man. Yeah, insane. And then this last one. So again, 3-month break, biochemically reset. I decided to do very low fat vegan food. And on that one, so it was stuff like it was porridge and water for breakfast. Felt like the Middle Ages, way back. Yeah, it was grim. Rice and beans for lunch, and then kind of fruit and things like that in between. But on that one, because of the amount of fiber that I was eating, I only ended up in a 40,000 calorie surplus. And just to kind of put that in perspective, the recommended daily amount is 30 grams of fiber a day. On that experiment, I was eating 175 grams every day. So it was just
constantly
going nasty, to the loo. Man. Exactly. It was really nasty. My wife despised me during that time. But so moving on from that, the calorie formula said I should have put on 5.2 kilograms on that one, but I only put on 4.7. So not quite the calorie formula, but fairly close, and certainly closer than the first one. And in fact, on that one as well, I put on 7.75 centimeters on my waist.
So more than the low fat fake food.
No, just shy. Yeah, it was 9.25 on the low fat fake food. So just not quite as much, but still quite a solid increase. And so I kind of laid that out to the world, and people have been debating it ever since.
So well, the things that obviously stick out is that in the first one, the low carb real food diet, that was obviously by default, when you're low carb, you're higher protein and you're higher fat. So you lost 3 inches on your waist, and you still gained 1.6 kilos, right?
1.3 kilos.
1.3
it was 3 centimeters off my waist. So
that's
just
three centimeters. Sorry.
Yeah.
3 inches. Yeah, you'd be fading away.
I would be. Yeah.
But that implies that you didn't gain fat, you actually gained muscle. So the body is processing that intake of food and that excess calories and it's excess the protein intake and the fat intake, and it's turning it into muscle rather than fat. Whereas in the other two diets, it implies by your sort of gain around the waist and your gain on the chin and everything that you're actually gaining fat. You may well have gained some muscle in there as well, because you didn't do a DEXA scan or any of the
I did do a bod pod.
That's it.
So not quite DEXA. Would have loved to have been able to afford six DEXA scans, but So I did bod pods for all of those. Actually, on the first one, I only did a bod pod at the end, which was because I only found it by way of kind of it going viral at the time, and then somebody offering to do it and stuff like this. But anyway, so I did it at the end, and it was 12.6 or something like that. And then after 3 months of biochemical reset, I did the bod pod before the low fat fake food, and it was 12.7. So that kind of tells me that my actual kind of at least my body fat didn't change that much. It would have been good to have actually kind of seen any muscle mass increase on that first one. But on the low fat fake food, as I say, it was about 12.7 that I started at, and I ended at 16.9.
Wow.
Just after 3 weeks.
4 point something percent.
Yes, yeah, it's quite an increase in 3 weeks.
Yeah.
And on that as well, my triglycerides quadrupled as well during
Wow.
that time. My HDL went down by a third. And yeah, no, I was just all over the shop in 3 weeks.
And you mentioned that in the paper that you were actually unsatisfied. Even eating all those calories, you could have eaten more. Like your body was still hunting for nutrients.
Yes, very much so. So on the first one and the third one, I was very full on both of them in kind of different ways, but I'll get into that in a bit. But on that second one, on the low fat fake food one, yeah, I could have kept on eating. I was the last thing that I had to eat was kind of like basically a bag of chocolate, essentially. It was literally that. Oh, and that was after like a low fat lasagna
Oh,
as well. So like it was a lot of food, but again, I could have kept on eating if I wanted to. I felt sick after about 3 days.
yeah.
And like for the rest of it after that.
I'm not surprised. And you mentioned you felt full in different ways on the first one versus the third one. I guess, the fiber intake was totally different. Like,
yeah, like really bloated. Like really bloated on that last one. On the first one, it was just like, look, I just do not need to eat, but I have to eat because I need to make sure that I'm eating all the calories. So I'm like slicing through the steak at like 9:30 at night, going, oh, and then I've got like 1,000 calories of nuts to eat after this. And
wow.
Like, that was nasty.
That's the bodybuilder's life, though, I think.
That was, yeah, that is 100%. Yeah, man.
Yeah. So why do you think it is that? I mean, I know some of the underlying mechanisms, but why do you think it is that low carb is better for weight loss?
Yeah. I mean,
For
there's
body composition.
Yeah, exactly. So I mean, there's a multitude of reasons. I mean, the first primary one is that the RCT suggests that the randomized controlled trials, that is, where it compares low fat to low carb, that it performs better. Basically, it has more significant weight loss than low fat. So it's a better place to start. But the actual kind of mechanisms are both that it's got higher satiety, and so like you're just better able to regulate your appetite, but also it leans into allowing your body to actually biochemically run as it should. Essentially, it enables you to get back to a proper homeostasis of where your insulin level should be, where your ghrelin level should be, where your leptin level should be, and it allows your body to function as it should, really, rather than kind of wild swings of dopamine and serotonin and things like this, and then like big drops from it. Like what you want is just slow and steady for everything, really.
Yeah.
And low carb is a good way to do that.
Yeah. I mean, so many people have the fitness industry is a little bit muddy with the whole calorie in, calorie out, which has an element of truth to it. And then, people on the keto, low carb, carnivore side that say, carbohydrates are the enemy. And there's a truth in both of those, because if you're in a calorie deficit, kind of regardless of what you're eating, you're going to lose weight. And you can do that with eating, lots of carbohydrates. But, there is muddy water there.
It's really muddy. And it's like, this is the thing. And that's one of the things that I really wanted to try and get across, is that it's really complicated. And, it's a case of both quality and quantity at the same time, but if you do focus more on a better quality, or just a more appropriate macronutrient distribution compared to the usual low fat model, then the quantity kind of takes care of itself, really, for the most part. Of course, you kind of you do have to check yourself before you wreck yourself, as they say. But at the same time, generally speaking, biochemistry leads and physics follows when it comes to the human body.
Well, that's the interesting lens when you look at it back through a history of time, up until even the last say 100 years. I mean, 100 years is a long stretch, but 50 to 100 years, when people actually started tracking what they were eating in terms of like calories in, calories out, how many chicken breasts, how many steaks. And we never had to do that. No animal has ever done that before in the past. It was needed to. They've just eaten and then they've stopped being hungry and then they've stopped eating. And whether you can debate, like the carnivore would have a kill and then you would gorge yourselves for a long time, or you'd have herbivores that graze consistently. But no animal really in the wild gets to this level of obesity and still keeps eating and eats itself basically to death, which is what people are doing now. And, without, like, we've screwed with the chemistry of food too much.
Yes.
Like we basically made satiety go down so that people can keep eating, but pleasure go up through the roof.
Yeah, that's exactly it, and that's the food environment that we're battling with every day. Yeah, that's something that we're trying to do our best to raise awareness of. And I don't know what the answer is in terms of how do we actually go about regulating ultra processed food. I'm a libertarian at heart, really, but there's got to be a line somewhere in terms of the fact that just imagine if food companies started putting in fentanyl into their foods. It's almost there. It's like, of course you can't do that. Like, you have to draw a line of like saying, right, we can't do that, because it's manipulating people's minds and biochemistry, and it's making them obese, and it's costing our healthcare systems too much and things like that. So
the problem is like, okay, you say you can't put, like, the sugar tax, for example, like, okay, companies lower sugar and then they just add more sweeteners or preservatives or artificial like flavor enhancers. And then it's like, right, we've got to ban the flavor enhancers. And then it's like, okay, well, because that's causing long-term cancer. And it's like, there's got to be an element of food companies having some sort of moral compass. And then that gets debatable. And then it's like, well, if people just had more control over what they ate, or just blah blah blah, I don't see, like, I see the only side is the education side on the consumer, because if you start taking away the ability for a company to sort of make money within the rules of the market, then you start playing with market forces and market dynamics, and it just has to be, in my view, the education piece and educating the doctors so that they know, because they just work with printouts as well. They go like, right, what's my nutrition printout? And then they have 10 minutes to see the next patient and 10 minutes for the next patient. So, like, education is really the only way. And it's so like blasé, and it's so like, it's been done to death to say just education. But I don't see any other way unless you start playing with the market more.
Yeah, that's it. And the day that we're going to be able to kind of actually put any kind meaningful legislation that would actually have any impact is just, I don't know whenever that would happen. So yeah, as you say, education, giving people the right information is our main focus as a charity, both healthcare professionals and members of the public. And we're hoping to get to that critical mass where it becomes that's just standard practice across the board. And actually, when you go out to your friends, family and GP and say, I'm following a low carb diet to help me on the road to remission for type 2 diabetes, then they'll encourage it rather than discourage it.
Can you do low carb vegan? Yeah.
Yeah, sorry, Finlay, I missed that.
Can you do low carb vegan?
Oh, yeah, it's totally possible. It's totally possible. But it's really difficult. For sure. I'm aware that there are a few people on social media that do it, and there are at least low carb vegetarian recipe books that I'm aware of. I don't know of any like full recipe books of low carb just vegan. It is possible, but it's really tough going. And then again, with any vegan diet, you have to be super on it in terms of your supplementation. You have to be so clued up, and you should be doing blood tests quite often. Like even every 3 months, at least for your B12 and your iron and zinc and stuff like that.
Yeah. I mean, I'm a bit, I wouldn't go as far as saying anti-vegan, but I'd let everyone know that I don't think you can be healthy on a vegan diet. I mean, maybe everyone says Djokovic is vegan, but you know, I'm pretty sure that he has an army of nutritionists, you know, and spending upwards of hundreds of thousands on his food and nutrition, and people who he employs on nutrition. So taking his version of nutrition, I don't think is applicable to most people. But there is like a wave of like anti-meat narrative that is still following on, and like you see a lot of, occasionally you see states in the US or sort of district schools who say, right, all of our students are going to be vegan now. And it's like, hang on, meat's incredibly healthy.
It's very healthy.
That keeps us from having nutrient deficiencies.
Yeah, massively. I mean, it's a massive part of our evolution. So you're just kind of you're discounting evolution if you know you're going down that route. But also, I mean, for kids in particular, it is vital that they have meat on a regular basis. And you know, study after study confirms that, you know, children that have meat on a daily basis are stronger and smarter. It's like that's just how it happens, you know. And it does worry me as a parent. I got 2 young kids. I've got one that's in school, one that's in nursery. But like even at the nursery, you know, they have vegetarian options for under 5s, and it's like
wow.
And even vegan version options. And it's like, look, these are developing children. They absolutely need animal foods in order to develop properly. Like once they're 18, sure, do what you want, but like they need that base of animal foods whilst they're growing, because otherwise they're just not going to be sufficiently developed.
It's crazy. Do you wade into the kitchens and say, what's going on here?
Yeah, well, I've had a fair few arguments with a few managers here and there, but I've managed to win through, and I've managed to kind of like ensure that even on meatless Mondays, my children have meat.
Good man.
Regardless, I'm just not letting that happen at all.
It's people have fallen into an ideology, haven't they? And to a certain extent, the same with when you get one ideology pop up on one side, for example, veganism, then you get the corresponding ideology on the other side, like carnivorism. And you know, I think people just get suckered into these like sort of community echo chambers. Yeah. And like and then they identify it with it, and that's their identity. Like the vegan community is so strong and so militant and so intertwined with ethical standpoint that it's like, how do you come back from that? And then the sustainability issue starts wading in, and then it's like, you should sacrifice your health for the planet. And it's just, there's so much wrong with those statements that you just don't know where to start.
No, it's really difficult. And as we were kind of like talking about earlier, you have to meet people where they are and kind of like take them slowly and just start to kind of, you know, show them that, you know, you might think this now, but you know, there are there's more than one way to skin a cat. And just, you know, it's just not how the world works, I guess.
Yeah, you just have to wait. And I think it's something like 5 to 8 years until B12 is sufficiently depleted in a vegan diet. Because I think there's like 5 years of B12 storage in the liver, and and so even when you're having these blood tests, a vegan
for the
first 5 years or so, it'll say that you have adequate levels of B12, and these other B vitamins will stay reasonably high and circulating, even though you are actually depleting quite significantly. So
and that's why you get people that are like, you know, are 20-year vegans, and then they go, you know, full on carnivore, and they're like, oh my god, I feel so much better.
That's the madness. I mean, who's the doctor? He's called like the nutrition facts doctor or something. He's a vegan, and he looks like
Michael Greger.
Yeah, it looks like nothing on earth. Like, you know, constantly shouting that vegan diet is the only way. And like you've got Dr. Sean Baker next to him, sort of, you know, 6'5" and absolutely ripped, like top of the rowing.
Clearly a good health.
Well, anyway, look, tell us just before we finish up, tell us about the date for the public health collaboration, who's going to be there, and where people can get tickets for that.
Yeah, so the Public Health Collaboration Conference, which does include Dr. Sean Baker, so good that you just mentioned him. So that's on the 19th and 20th of May in Sheffield. It's at the Crucible Theatre, which is where they hold the World Snooker Championships for anyone that doesn't know.
Didn't they just have a big protest there? They had a big protest.
Did. Somebody ruined one of the snooker tables by like throwing orange dust on it or something like that. And
climate protester.
Also, it's like, well, don't pick on the snooker guys. I mean, look, they're just
the least invasive of any of the sports.
Exactly. But anyway, so it's going to be there. It's going to be a lot of fun. So as I said, we've got Dr. Sean Baker there, and he'll actually be in conversation with a plant-based doctor called Dr. Chidi, and they're answering the question, do we need to eat plants? And in addition to Sean and Chidi, there'll also be Anthony Chafee, but also Patrick Holford, and Andreas Endfeldt from dietdoctor.com as well. So that's going to be a really big panel discussion. That's on the Saturday specifically. But on the Friday, we've got Dr. Ben Bickman also coming across from the States. Great. Yeah, he's absolutely fantastic. For those that don't know, he's like a professor of cellular biology from Utah, and he's going to be talking to us about insulin resistance, which is kind of the source of all of the metabolic health issues that we were talking about earlier, all of the chronic diseases, also on that day as well, on the Friday, what do we have on in the afternoon? We've also got an Alzheimer's panel as well, with Patrick Holford, who I mentioned earlier, but also Ben will be there, and Georgia Eade, who's a psychiatrist from the States, and she'll, as well as doing an Alzheimer's panel on the Saturday, she's doing a panel on food addiction as well, because that's something that we're starting to move into helping alleviate, is helping people overcome those food addictions, which links back to the ultra processed foods. That's what's kind of really kind of heightening people's food addictions, is all of the ultra processed foods out there. And then also on the Saturday we have a Are Cows Destroying the Planet panel as well. So we've got the author of The Great Plant-Based Con, Jane Buxton, chairing that, along with a few farmers and a couple of academics who are going to be discussing Are Cows Destroying the Planet? So that might be one to show to your plant-based friends.
A yes or no answer from you? Are cows destroying the planet?
No.
They end of discussion.
Almost, yeah.
Oh, I love it. I wish I could make it. I'm not getting back from Mexico until June, early June. So I'll have to get there.
That's a shame, but I'm happy to announce that we will be live streaming it. So tickets will be on sale for that by the end of the week. So if you go to the website, if you are in far corners of the earth, then you can still watch it live online. So if you go to phcuk.org/conference, then you can buy your live streaming ticket, or if you want to come in person, you're more than welcome.
I love it. Sam, thank you so much for joining us today, and I'm looking forward to seeing all the great debates that you have, and great work with the public health collaboration. Keep pushing.
Absolute pleasure, Finlay. Thanks very much, mate.
Cheers.